The Positive Pause is a motivational-minded podcast covering topics women want to know about as they journey to and through menopause, focusing on subjects that impact women's health and healthy aging, including what it means to age healthfully. The Positive Pause features experts and influencers from a variety of industries and specialties. The information and opinions expressed on the Positive Pause are not intended to replace the services of trained professionals or to provide specific medical advice. To see the National Menopause Foundation's full medical disclaimer, please visit nationalmenopausefoundation.org.
Welcome to the Positive Pause. I'm Claire Gill, founder of the National Menopause Foundation. Joining me for this episode is Ann Garnier, co-founder and CEO of Lisa Health, the creator of the Midday App for menopause and healthy aging. Ann is a seasoned healthcare leader and operator, helping to create, launch, and scale innovative healthcare technology companies and products that have improved patient outcomes and access to care. She is passionate about using technology to transform women's health, advancing research on menopause and healthy aging, and helping women thrive in midlife and celebrate the start of something great. Well, that's something we can relate to. Thank you so much for being here, Ann.
It is such a pleasure to talk to you today, Claire.
Thank you. Yeah, so I'm really excited to bring to our listeners more information about the great work that you are doing at Lisa Health. But you've been at the forefront of technology in healthcare for a number of years. So let's start by talking about what made you decide to focus your current venture on menopause.
Well, I had the privilege earlier in my career to lead the development of several tech-enabled women's health products and services, including solutions for high-risk pregnancy, preterm birth, and fertility. So when I decided to start my own company and was thinking about what problem I wanted to tackle, I just kept going back to this passion I have for women's health. But I had moved beyond my reproductive years. And what was really interesting to me was what is happening to women's health, after 40, right? Which we know is one of the most underserved areas of healthcare. So I was researching opportunities in this kind of broader space of midlife women's health. And coincidentally, I experienced my own menopause transition. And even though I am this incredibly knowledgeable and empowered healthcare consumer, like most women, I felt so blindsided and, disappointed in my doctor visit and really struggling to figure out how to get these symptoms under control. And it just dawned on me, like, if it's this hard for me, what is this like for the average woman? And I swear from that moment forward, I just became so passionate about using advanced technology like artificial intelligence to just transform this menopause journey for women worldwide. That's
fantastic. And that's how so many women come to this space, from what I've heard. That again, just having gone through the experience or started it themselves and looking for something to help them and then not finding it. And thank God for women like you who said, well, I can do something about it and make sure that other women do have these solutions. So That's really terrific. And clearly, like you said, there's a need. And I always say this, I feel like very much so sometimes I am in a bubble where I talk to women and men about menopause pretty freely, but that's not necessarily the same conversation happening beyond our world, as you said, in women's health. So really, really important to kind of figure out what we can do to help women, through this journey. So then let's talk now about what that was that you created. So the Midday App from Lisa Health, you're working with some major medical and research institutions. And can you talk more about that and explain to our listeners what it is and what the app helps women to do?
Sure. So Midday is an app, a digital health solution for helping women to manage their menopause and healthy aging journey. It is what we call an end-to-end solution. So it's very comprehensive, and it includes insights into where you're at in your menopause journey, specifically your stage, and helps you track that, along with advanced technology for symptom tracking using wearables, so like your Fitbit or your Apple Watch. And then we personalize this journey to you. So based on your symptoms and, other health concerns, we can actually then guide you to the, science-backed education and therapeutic support that, women want and deserve in this life stage. So we offer a full experience. Our therapeutic support strategies are everything from holistic options that are evidence-based, like hypnotherapy, cognitive behavioral therapy, through virtual care with, top menopause specialists. Now, you mentioned we worked with some research institutions. So we have had the incredible privilege of working with experts at the Mayo Clinic as well as SRI International.
Mm-hmm.
We have shared values around ensuring that women have access to solutions and education that is evidence-based and science-backed. And we really are unique in this collaboration with top clinical and research institutions, as well as this evidence-based deep tech approach that we've taken.
Well, that is crucial. And I think that's certainly how we approach things at the National Menopause Foundation too, which is why I was excited to speak with you particularly about this product, because there is so much information out there and there's so much misinformation. And again, when there's so little that women understand about this stage of life, then you want to make sure that we direct them to the scientifically backed information about menopause, what they're experiencing and then what works. And there are, I'm sure, and there's a lot of innovation and there's a lot of wonderful things happening in this space. And we all want those solutions to come to fruition, but they need to be studied. They need to be proven that they actually are going to do what they say they're going to do and not harm women as they are trying to do this. So I love that you're working with the Mayo and with the others to kind of make sure that all those recommendations are fully grounded in what is known scientifically about how to address these needs of women. And that's really terrific. So I appreciate that. And I'm sure that our listeners will too, because, right, you Google, we call it like Google, Dr. Google, and it's not always the best advice when you look at Dr. Google. So I hope we'll take time to look a little deeper or go to resources like yours and ours to kind of get that information they need.
Well, the good news is that, we are talking about menopause more openly, and there are more resources and education available. But along with that comes the other side of that coin, right? Kind of the darker side, where there's a lot of misinformation, a lot of companies that are coming into the space with solutions that are ineffective or may even be harmful to women. And I think it's really super helpful to talk to other women and get their input. At the same time, you have to recognize that what worked for one person may not work for you.
Right.
And so really having a data-driven solution that is going to personalize this journey and support for you, I think is really vital.
That is absolutely key. And one of our first surveys we did about where women went to get information about menopause, their friends, their friend group was one of the top responses. And that's not surprising, but like you said, it is such a unique experience for women. And we can make some common assumptions around it. Like, like the average age for natural menopause is 51, but you talk to any woman, even in your own circle, and some will be 51, some will be 53, some will be 49. It really is different. So that personalization is so important. And it's not easy, to find that really good information and something that you can trust. And unfortunately, there aren't enough clinicians or healthcare providers who really know how to help women with the menopausal experience, which is something that we're all working on to improve. So having access to those people through other means is really important. And it's great that they have access like that on the Midday app too. So I imagine there's some unique challenges.
Sure.
Working with technology in healthcare. And as we just said, with it's not the same for every woman, probably even more so in the women's healthcare space. So what are some of those challenges you face as you work in technology and healthcare?
Well, this answer may be unexpected, but I actually think one of the biggest barriers is there is an assumption that women in our life stage do not use technology or don't know how to use it.
Wow.
It just astounds me, right? I mean, it just smacks of ageism and so many other
Right.
things, right? So you tell me, what woman over
Doesn't know.
40 does not have a cell phone glued to her hand almost all day long, just because we've all come to, I think, rely on this little mini computer to do so many things for us. And when you think about it, the women who are probably most motivated for guidance, right, are the ones who have acute symptoms, right? Like hot flashes
Mm-hmm.
are really bothersome. They're not sleeping at night. And so that's why they're up late at night on Dr. Google trying to figure stuff out. So these women are 45 to 55 years old. They're Gen Xers.
Right. There's no way they're afraid of
We were the
technology.
first cell phone user. I mean, come on. And probably a lot of those women have used a period tracker, right? An app for period
Mm-hmm.
tracking. Highly likely they use some kind of app for pregnancy, right?
Yeah.
And maybe
Yeah.
even fertility. So this notion that women are not capable or interested in using technology to manage their menopause journey, like that is just a load of bunk. And so I think actually that is the biggest barrier
Wow.
that we face. And I know, right? It's ridiculous.
That was not the answer I expected. Really.
Exactly. You thought
Yeah.
I would say something like, well, AI, you need a lot of data, but right. Like I could get into all of that, but I just think from a ground zero perspective, the biggest barrier is, investors and large organizations, health plans, employers, health systems, just kind of thinking like, we don't think these women are going to use technology. And I hope your listeners, register loud and clear. I remember years and years ago, when I walked into a doctor's office and they didn't have an electronic medical record, I'd just tell them straight out, I'm not coming back until you have an electronic medical record. They'd be like, what? I said, these type of records, this is so Stone Age. So we're kind of in that same place, I think, where we just need for everyone to recognize that not only do women want and deserve more solutions, but why should 3.8 billion women be left behind the technology revolution? We are applying AI and sensor technology to virtually every other healthcare condition under the sun, right? From pregnancy to diabetes and cardiovascular disease. Should menopause be left behind? I don't think so.
Well, thank goodness that you don't think so, because there is not that awareness or interest outside of people who are passionate about women's health to actually get this done. And, it's like, as you and I said the first time we met, the fact that in 2019, I was creating a nonprofit about menopause is insane.
I know.
Why wasn't it done so much longer? And again, that not to say honestly that there were some organizations working in this space. I was not the first nonprofit to come along and do this, but on a national basis, focused solely on menopause, it was. And I think that's very telling that it took us that long to kind of get to that representation and on a nonprofit, on an patient advocacy side. So really interesting. The other thing and I thought, again, sort of tied to your, wow, how backwards is it that they think we don't use technology? I think the other thing that people don't realize is clearly, as we're talking more about menopause and more companies and groups and organizations are getting into this space, there's got to be some potential here as a business. So can you talk a little bit about what the current market in menopause is, and is it, forecasted to continue to grow?
Oh, yes. So the latest projection is that menopause will be by 2030 a $24 billion market. It's the largest market in women's health by a wide margin. And again, it's shocking. When I looked at this space a few years ago and other than a few pharmaceutical companies and maybe, a few other players, like there really wasn't anybody doing anything. And I thought, what is going on here? This is a massive market.
Yeah.
Like massive, clearly underserved. Like women are dying on the vine here. It's bordering on criminal neglect. Like what is happening? And so that part of things, like, it was just such a no-brainer from a market size. I want to emphasize to your listeners that we, midlife women, have the most economic power in the world. Our pocketbooks are bigger than anybody else's, and you need to vote with your wallet, right? We always kind of talk about that more broadly, right? But you have so much economic power to wield. Use it, but don't use it on the wrong things. Because I will say that as much as I love the fact more companies are coming into the space, because we do need so many solutions for women. There's like 34 symptoms. My God, we need a lot here. But be discerning, right? Be discerning in the products that you do purchase, and look for evidence of that they've done studies, that they have something to back up their claims. They've gone through the kind of rigorous product development process that you would expect to see for their category. In our case, the gold standard is to have affiliations with top research institutions and clinical people. So, I have a whole checklist because I did a presentation on this for the Mayo Clinic earlier in 2022, when one of the questions was, how do we know whether a solution that we should suggest to our patient is a good solution, right? It's one that we can trust. So I had a whole checklist that I gave them, and I'll be happy to forward that over to you, Claire.
That would be really useful. And I'll put it with the show notes for this, because I think that's something that all women should think about, as you said, when you're sort of trying to decide, is this legit? And particularly when it's new and innovative, how do I judge that? So I love that you have that, and that you're helping clinicians to figure that out too, because often that's who you turn to. And if they don't know what's available and what's on the market, then that's going to be really hard. So it's interesting, we were talking about like the size of this business and the 23 billion. And I was trying to think of other, like putting that in perspective of other industries. And I don't want to like put you on the spot, because I was trying to Google as we were talking to see, I can come up with 23,000 businesses. Like SpaceX is, billions. But when you said you had done stuff before in like fertility and stuff like that, so is that comparable? Because I think we think now, like, wow, there's so many advances in women's health around fertility thing. Is it the same kind of size, or, is menopause still smaller than some of those other women's health categories?
No. So, the global fertility market was valued at 21 million in 2021.
Wow.
And it's projected to reach 90 million by 2031, according to Google.
Wow.
I will admit, though, for anybody listening, if you're like a market research geek, I have not done a deep dive into the market size for other markets in a while. But I do know that the menopause market is massive and much, much larger than almost any other in women's health. So I think we can put a pin in that.
That's significant. Millions. Once you get from millions to billions, that's definitely in a significant area. So that's good for us. And, as I said, and I love, again, reinforcing for women at midlife, the empowerment aspect of that we really do control so much of the purchase power, and we can influence what comes to market based on what we need, if we would just take care of ourselves the way we take care of everybody else in our lives, and put our own needs forward, which is really, really important as we think about this whole sector and this whole journey that we go through. So having spent a lot of time in this space and working on providing these solutions for women, what do you wish more women, or even men in their lives, knew about menopause?
I think we need to acknowledge that it's a life stage, right? that it's not a disease or a condition. It's just truly just, sort of the next step in your reproductive journey when you go from, a reproductive state to a non-reproductive state. And I also want to make sure that, women and others around them are mindful that the medical community was trained to understand that, your perimenopause stage, which is a stage before reaching menopause when your periods stop for good. But that perimenopause stage started when you have menstrual cycle irregularity.
Mm-hmm.
We now know, based on more recent research, that symptoms actually can happen well ahead of any kind of changes in your menstrual cycle. So I think what has happened for who knows how long, women were going to their doctors and they were saying, oh gosh, I'm just not sleeping well. I'm so tired. I'm having headaches. I'm really irritable. Like, they're talking to their doctor or healthcare clinician about these things. And, the clinician is saying, no, it's not perimenopause because you don't have a regular menstrual cycle. So being sent away, right, not having the symptoms acknowledged as the beginning of this perimenopausal journey, right?
Mm-hmm.
And then going through this years long sort of trial and error cycle, trying to figure out what is happening to their bodies, or just not doing anything because they just think, well, I guess this is just, it is what it is.
Yeah.
And I just have to deal with it. So I really would like for people to know that perimenopause generally starts in your early 40s, although for some women it can happen earlier in your 30s. And menstrual cycle irregularity is not necessarily the symptom that you hang your hat on to say, I am now officially perimenopausal.
It doesn't have to be the first symptom, right?
Exactly. And if your doctor or clinician is still telling you, no, you're not, go find an expert, right? Go find a practitioner who is certified by the North American Menopause Society. There's a nice clinician finder directory on the North American Menopause Society website.
That's right. We promote that all the time. It's really important to find that. And then the same thing for women who may not be, in their area, have someone who is on the NAMS list, then, there are these other options available online now with telehealth that people should look into, because there's just unfortunately not enough clinicians who are trained to be able to take care of the 1.3 million women that enter menopause every year. So a lot to do ourselves.
Yeah, there will never be enough trained clinicians. I'm sorry to say, ladies who are and others who are listening, I think it's virtually impossible to bridge this gap, at least in the next decade, which was one of the reasons I was inspired to create the Midday app, because it is the opportunity for every woman with a smartphone to access a very high standard of support on their menopause journey. And, by the way, I mentioned a few minutes ago, trying to understand where you're at. We do have, as I mentioned in the beginning, a very novel algorithm that will help assess where you're at in that journey and then help you track that. So you always know you're never blindsided. And it does a lot of other things, including provide virtual care. That's just one resource for you if you're in an area where, you're not finding that a menopause provider is available to you. Yes, Claire, absolutely. There are now companies like ours that provide these services.
And that's what's needed. And I think, again, that's just going to continue to grow. And hopefully that will be able to bridge that gap a little bit for people. And then if we do what we continue to do in this space, then hopefully we'll help those healthcare providers get their information they need too. So, your primary care doctor should be able to, help you in this journey. And the other thing women have to remember is you don't stop seeing a gynecologist just because you're not doing obstetrics, you're not, doing the baby. I had this conversation earlier today, actually, with a younger woman. We were talking about that journey and what we don't know, even in our younger years, about it, and that the equivalency to puberty and how everyone knows that. And we learn about that and it's so common. And then no one knows about what happens at menopause and, how do we do that? And, she was saying just knowing a little bit ahead of time about what those possibilities are. And as you said, when does the journey begin for me? And what complicates it even more is these days, women are fortunately having children a little bit later in life. And that average continues to go up. And then that becomes more confusing. And I remember I was saying to her, oh, yeah, I had my child. And then 2 years later, I was, having irregular periods. I was like, oh, am I pregnant again? And the doctor's like, no, you're actually perimenopausal. And I was like, wait, I have a 1-year-old. How is that possible? But that's because I was a late mom. And so we're saying like that's something that confuses women. And then the other thing that we need to think about when we think about this journey is not all women choose parenthood, but all women will, and anyone born a woman will go through that menopausal journey if we're healthy enough and if we live long enough. So it's really important that we know what's going to happen and we experience that. And like I said, there's far more education about reproduction and about the parenting journey. And yet not every woman will go through that. And so we really do need this extra effort on what this experience, this life stage that we're going to go through and how to like manage that the same way we manage every other life stage. And that's what's so important for all of us to kind of keep in mind. Yeah.
Well, very few physicians are trained in menopausal care. And just a shout out, it's we're recording this on the last day of January, and January is Cervical Cancer Awareness Month. So to your point, women think, well, I'm done having babies. I don't really need to go in and have those checkups anymore. That's not the case. Especially if you're under 65, just a little PSA kind of shout out here, ladies, don't neglect your annual well woman visit. It's covered by, all insurance. So once a year you can go in and you can get all your basic testing done. So please do that. It's super important to catch things like cervical cancer early.
Yes. And we do a great job of it, I think, with the awareness around breast cancer, and women might get a mammogram, but they're not getting their other test. And that's right. You're right. We have to make sure that women know to be able to take care of your holistic health, in general. So tell me a little bit, I forgot to ask this the first time we met, but so Lisa Health and then Midday App, but how did the name Lisa Health come about? Is there a story there?
Sure. We obviously started the company before we had a product, and we were trying to brainstorm quickly because as any business, you need to be able to register your corporation and do all sorts of that kind of official paperwork. And Lisa was the most popular baby girl's name 50 years ago. It was number one. And what was astonishing is that it wasn't just number one, like for 1 year. It was number one for this unprecedented streak of like 10 years. And it was in the top 10 for about 18 years in total. I mean, no other baby girl name even like comes close. I think there's maybe one name that maybe was in the top 10 a couple times. So we just kind of were thinking like Lisa, like everybody knows a Lisa, right? Like, you have a sister, your mother, your friend. It's like your trusted guide on this journey through midlife. So it just felt really warm and supportive. But when we were getting ready to launch the Midday app, we were thinking about it with much more thought and care, right? Because we had the luxury of time on our side. What do we want to convey to women, right? And so midday is defined as that point in the day when the sun is at its brightest and strongest. And it really just so beautifully fit with, how we think of women, which is midlife is when they are at their brightest and their strongest. I mean, it was just perfect.
Love it.
That's how we came up with both of those names.
I love it. And it's so true about Lisa. I didn't realize that. It's so funny. I'm laughing. My family has all these Irish names. Like I'm Claire, but my sister is Siobhan. My brother's Brendan. And then my Irish cousin, they went with Lisa. That's one of my cousin's daughters. And I love it. I'll have to tell Lisa that she is from a long, long line of women most popular names.
Absolutely.
That's great. Well, Ann, thank you so much for taking time to speak with me about your company and insights on this exciting section of our world now that is menopause that I hope will continue to grow and develop. And like I said earlier, I'll make sure that we have information about the website and the Midday app and the checklist that you offer. Just put all of that with the notes with this episode so our listeners can follow up and learn more about you and your work.
Oh, thank you, Claire. Well, if anybody wants to learn now where they can go, midday.health, midday.health, and you can learn more. And, everybody shout from the rooftops about menopause. Really, we are not just having a moment, we are red hot. And so now is the time.
I agree. It's a great time.
Right? This is the time. So thank you so much, Claire. This is such a pleasure. And it was a lot of fun.
Thanks. Yeah, I did too. And I look forward to more conversations with you and with other experts here on The Positive Pause. I hope everyone enjoyed this episode as much as I have. If so, please subscribe to the Positive Pause podcast so you never miss an episode. And please share the information about this podcast with your family and friends. Thanks again to my guest, Ann Garnier. And thank you for listening. And we hope you'll tune in to another episode of The Positive Pause.